There we go. All right, it looks like we have our slides up today. So welcome to the Parenting Through Head and Neck Cancer Diagnosis, Treatment, and into Survivorship, presented by the Head and Neck Cancer Alliance and the American Head and Neck Cancer Society. We're very happy that you are here with us today. I am Beverly Garber. I'm a nurse practitioner at the Department of Otolaryngology, Head and Neck Surgery at UC Davis in Sacramento, California. And I am pleased to moderate this webinar as parenting through a cancer journey, impacts the entire family and profoundly can have an impact on children. So our webinar today will provide some guidance on how you can have a simple conversation, open conversation with your children. We will learn from a child life specialist, as well as 3 parents who have experienced a head and neck cancer diagnosis, and how to maintain a sense of connection and provide the opportunities in sharing and self-expression to help the child throughout their experience. So we again have a wonderful panel of participants today. So I thank you all for being here and sharing your feedback and answering questions from the webinar audience. We will welcome your questions in the chat or Q&A throughout the webinar and do our best to keep up with them. And then we have time at the end of our webinar to review them as well. So our first panelist I'd like to introduce is Mr. Michael Murphy. He is a loving husband and father of 2 children. He is a neuroscientist and psychiatrist at the Harvard Medical School and a survivor of HPV-attributed tonsil cancer. He lives with his family in Boston, and his kids are aged 5 and 9. So thank you, Michael, so much for being here today. If you would, please tell us how you chose to discuss your cancer diagnosis with your kids.
Thank you so much, and thanks for having me here tonight. I think that is such a difficult and important question and topic to address. And before I say anything else, I should say that, first of all, none of this would have been possible for me without my wife, my co-parent, who was a sounding board and an equal partner in all of this. And basically, every decision we made around what to tell our kids and how to tell them was made in consultation and discussion and around our shared values. I think when I was diagnosed and when I was kind of figuring out what was happening to me and how I was going to make sense of it for myself, one of the things that I was interested in is what did people in my situation do in terms of talking to their children? And at that time, I really couldn't find a lot of resources. When I looked up kind of online groups or things that had been written, a lot of it was from the perspective of parents who had children who had cancer or older adults who had cancer. And so I really felt like there was a sort of gap in the resources available. And so I really appreciate why we're doing this kind of thing tonight. For me, as a parent, one of the values that I hold really dearly is the idea of transparency, being as open and honest with my kids as possible for a variety of reasons. I think most importantly, kids are smart. Kids are going to observe the world. Kids are going to figure things out, and they're going to create explanatory models for what's happening that may or may not be accurate and certainly could be scarier than the truth. And so when I was diagnosed, I decided that I was going to tell my kids as much as I could in a way that they could understand. So as you mentioned, my daughter was about to turn 9. My son had just turned 5 when I was diagnosed. And this was happening during the height of COVID. So we were already pretty isolated from the people around us. It was really just me, my wife, and our kids. At first, when I first heard the C word, cancer, I didn't know what kind of cancer it was or what treatment was gonna be like. I didn't tell my children, that I was going through this process. But once we had a plan, once we knew, okay, well, you're gonna get radiation this many times, you're gonna have this kind of chemotherapy, here are the likely side effects. Then I began to talk to my children. And because they were so young, I tried to talk with them in language that was true and also stuff that I felt like they could understand. So I told my children that I was very sick, but that I was going to get treatment from a really dedicated, driven treatment team, and that I had a really good chance of coming through this okay, but that it was going to be really hard, that I was going to have some physical changes, that my hair was going to change, that my neck was going to get red, and that I was going to stop eating and even have to use a feeding tube. And I really wanted to normalize as much of this as I could. So I could not bring them to the hospital with me because of COVID, but I tried to sort of destigmatize and to normalize a lot of the treatment. So there's pictures of my daughter and my son pouring uh, liquid food into my feeding tube. And I really wanted them to see that this thing that I had in my stomach was not bad. It was not scary, but actually helping me and keeping me alive. And as you can see in sort of the lower two pictures, my face changed. I kept my beard for probably longer than I should. It got really scraggly by the end, but I was determined to hold on to it. Um, and I wanted them to understand kind of why I was looking the way I was looking. And when my treatment was done, when it was the last radiation day, they knew that it was important. My son, you can't really tell, but he's dressed up as Sherlock Holmes for some reason. I think he thought that was the appropriate way to mark this. Uh, and so we could all celebrate together as a family. So I think that by telling your kids, by bringing them into the story as openly and as honestly as you can help assuage some fears, guide some expectations, and have it be a shared experience.
Thank you, Michael. Sorry, I have to remember to mute myself. Our next slide here, you have something that I think is so valuable to speak upon.
Yes, I forgot about this. Sorry, this is my daughter's diary. So when my daughter learned about my diagnosis, she really wanted to write. She has always loved to write, and she wanted to write something that'd be useful for other kids going through a similar experience. And so we encouraged her to be, communicate as much as she wanted to by writing in this sort of online journal. And she wanted to post it to share with other kids. And so I took a page of it and put it here with her permission, of course. And you can see kind of her understanding of my symptoms, her talking about the changes in my diet and my energy level over the course of the treatment.
Well, thank you so much, Michael. I think honesty and clear communication with, accurate terminology that can be easily understood by, a child is so important because as you mentioned, kids, they pick up on all sorts of things. And so, sharing as much honest communication as possible every step of the way can certainly help reduce some fears. So this is a perfect segue because next I'd love to introduce Emily McDaniel. She is a family systems and coping specialist and certified child life specialist at UC Davis Comprehensive Cancer Center here in Sacramento, California. She was also very helpful in supporting my own 8-year-old daughter during my cancer journey. And so thankful for Emily for sharing her knowledge and expertise with us today.
Thank you, Bev, for that warm welcome and for having me here. Yes, so I'm Emily, and I have been here at UC Davis working as a child life specialist for the past 12 years. And before working specifically with children of adult patients, I worked in the pediatric intensive care unit and also helped to build our department education programs. Both of those experiences helped prepare me for work in this specialty. I am really excited to be here today, and I would first like to acknowledge the vital impact that families I've had the honor to work with have in the support I'm able to offer other families as my perspective continues to broaden, and I feel so thankful for that. Now, what does a child life specialist do? Eileen, if you could advance. So oftentimes child life specialists work to serve pediatric patients. However, my scope of practice is different, where I'm serving adult patients who have minor age children and who are experiencing a life-altering illness, injury, or who are nearing end of life. Child life specialists have background and expertise in understanding how to support family coping despite these critical medical situations. And as with any specialty, theories help ground our work and serve as data points as we assess how families are coping and think about supportive strategies. So for the direction of this talk, I'd like to introduce 3 theories that I keep as part of my lens all of the time. So family systems, we are inseparable from a family unit. So if there's a change in one member of the family, it is going to have a direct impact on the whole family. And then developmental theories, children may be at different developmental points throughout an illness trajectory. So keeping that as part of our lens as we're thinking about how children are coping and what support may be helpful is important. And lastly, stress and coping theories. These help us better understand how families perceive stressors, what kind of strengths they have to adapt to these hardships, and then for us as clinicians to think about supportive interventions to promote resiliency. Now, let's take a look at some important details as we continue on with this talk. Eileen? So cancer patients that have children under 18 years old, they're 25% of cancer patients have children that are under 18 years old. So that is a lot of children impacted by a parent's illness. And unlike other cancers that can be hidden illnesses, head and neck cancers can directly impact activities of daily life, which I think adds an additional weight to these situations where parents may feel even more stripped of their control and how they approach a situation with their children, as sometimes they can't dictate a timeline as well as in some other cancers. And then when a parent is diagnosed with cancer, of course, one of their top concerns is the well-being of their children. And what do children need most in these situations? Michael said it very well. So thank you for helping to kind of lay the foundation here, but they need honest, developmentally appropriate parent-child communication so they feel included in the situation. This is an empowering, growth-promoting process and confirms that families will weather the storm together. And this also helps prevent children from worrying alone, because sometimes children can be emotionally isolated based on what they're just hearing, but may not be included in the conversation. And so that's a point I talk to parents about pretty often. And when I first meet with parents, often our first conversation involves reviewing what, when, and how. How do we approach this conversation with children? So Eileen, thank you. So we talk about how much can a child carry. Children can handle hard things when they have the support and tools needed to cope. As a clinician, I strive to convey how resilient children and families are while also trying not to minimize the impact of the illness on the family. And before on the next slide, before we get to reviewing a sample conversation template, let's review a few key points to consider. Eileen, we can hop back to the slide before. Thank you. But you want to keep the information clear and simple, and you can think about a luggage analogy. So younger children typically need fewer details and less information, and older children will appreciate more details and can imagine the future better. So they may have some bigger questions. You want to dose information, so keep the conversation about what will directly be impacting the child, their life, the schedule, how a family is looking or feeling. For example, if you're not receiving radiation for quite a while, you can save that information. And then if there are large age gaps or big differences in temperament with children, it can be helpful to separate these conversations as well. And then using tools to enrich understanding. Children learn best when they can interact with materials and learn by doing. So thinking about integrating books and other teaching tools can be helpful. And then modeling coping ideas. This is something we as parents can keep in mind often, just in going through regular stuff in life, but especially when thinking about hardships and a cancer diagnosis. Modeling coping ideas for children can be really powerful. So, for example, when I'm worried about what's to come, I think of one thing that brings me joy. Or a 12-year-old in a session this last weekend told me that when she feels anxious, she just counts to 5. So thinking about these grounding strategies can be really helpful for kids. And parents often are wondering if they should wait to have a conversation with their children when they're not as emotional about it. And I think what you mentioned, Michael, about how you waited until there was a plan is smart. And that also allows you to digest the information, which can be great. And I also, though, tell parents that it's okay to show emotion. Crying or being mad or sad helps give children permission to have those feelings. So it really validates how they may be feeling as well. Okay, so let's keep these ideas in mind as we go through just a sample template for what a conversation could look like. Thank you, Eileen. So it's great to preface this conversation with, I have some important information I'd like us to talk about, just to set the tone. And this template can be applied to most difficult conversations. But when thinking about cancer, there are a few really important connection points that you'll want to have with the kids. And that is definitely when there is a new diagnosis, when there are treatment plan updates, when there's an observable new physical change or condition that a parent is experiencing, or the illness trajectory changes in a big way. So Eileen, if you wouldn't mind hopping back to the last slide, that would be awesome. I know the PowerPoint can be super tricky sometimes, but you'll want to start with a simple background. So, I've had some trouble swallowing. I went to see the doctor the other day, and then share what has happened recently. They did some testing and took pictures of my neck. They found out that there is a lump in my neck, and it is a group of unhealthy cancer cells. At this point, it's good to assess and check what the child understands about cancer. They may have had experiences shared from a classmate recently, and this could help their understanding of cancer, or it could lead to misconceptions about cancer, which you could then clarify. And then you can offer a brief explanation. There are different types of cancers. The type I have is cancer in my neck. For me, this means there are unhealthy cells collecting in one place. This is causing pain in my neck. And then what's coming up? So the doctors and team are going to create a treatment plan. This plan is going to help get rid of the cancer. I will start by having surgery and then transition. So address questions, feelings, and switch gears. You can introduce any type of communication intervention. One example could be just having a home graffiti wall where you put a big piece of paper on the wall and you can share thoughts, feelings, questions at any point. And this helps children know that the door is going to continue to be open and they can share feelings. And this is going to be something that you will handle as a family community. Okay, thank you. Thank you, Eileen. We can advance. And then in addition to thinking about teaching tools, analogies can be really helpful. I have listed a few on this slide, but it's really even better if you can individualize an analogy to something the child is interested in. For example, I have healthy cells are players on Team Healthy and each have a job to do. Cancer cells don't have a job in the body and get in the way of the healthy cells keeping the body working well. Or you can think of cancer like weeds in a garden. Weeds get in the way of a healthy garden, but there are ways to help get rid of the weeds. And so now that we've created the communication bridge, let's talk about supportive strategies. So children and families in these situations, of course, are trying to figure out their new sense of equilibrium, and some of these ideas can help with that. So having regular family meetings and planning sessions helps prepare everybody and keeps everyone on the same page. It also allows space for feelings to be shared or questions. And then family coping plans, these can be something formal or casual where you just talk about grounding strategies that may be helpful, or you create a family coping kit, or you come back to that graffiti wall. There are lots of different options for that. And then thinking about maintaining routines and boundaries, I think we can all agree that when we have routines, we feel safe. And so for children, if one part of their life is a little bit of a roller coaster, keeping other aspects calm and as smooth as possible can be really, really helpful in these situations. And then readily available information. Parents and I have talked about how helpful it is for children to have information at their fingertips around the home. And so this helps ensure that they're getting credible information And so kind of having some coffee table books that you've maybe reviewed together, but are also available for them to look at can be helpful. And then thinking about expressive activities, those are important. Play, nonverbal and verbal outlets, art, writing. And so just keeping those going. And then support groups and other outside resources. These help children feel less isolated in what they're going through. And I'll be excited to share a few I highly recommend in just a few slides coming up. So let's think about coping. A lot of times parents are wondering how their children are coping. Some children will ask a lot of questions. Some children will not be asking questions or wanting to talk about the situation at all. So let's think of some different considerations to keep in mind. We can advance, Eileen, thank you. Okay, so childhood coping looks different depending on the age of the child, what the situation is, and parents are the experts. So they are going to be able to assess how their children are coping best. But some points that I talk to parents about are coping considerations being developmental level that they're at. So what is the child experiencing developmentally? What kind of stressors may exist just at baseline on their development? And then baseline temperament. What is the child's consistent style of coping and reacting and coping? I mean, that's what temperament is. And so if a child is challenging before an illness, that likely isn't going to change after an illness. And so thinking about that, and then also thinking about expressive patterns. Children may be quiet or more talkative. And so just keeping that in mind, if a child is quiet before an illness, that isn't likely to change either. And then some questions to consider if wondering about seeking additional help. Is the child engaging in their regular activities? It's normal to have stress in at least one area of a child's life, but how disruptive is that stressor and what does that look like? Are earlier coping strategies no longer helping? Or is the child trying to create a sense of control in other ways by acting out or repetitive behaviors? And if behavior isn't getting to a new normal that is manageable, persists for more than a few weeks, and or is getting worse, connecting with a mental health professional is best. And I talk to parents about this a lot, especially if the prognosis is poor. Having some long-term support in motion can be hugely helpful for children. And usually I let the parents know to connect with the pediatrician so that they can connect them to a referral that suits their needs. Okay, so now let's think about the resources out there that exist for families who are impacted by a parent's illness. And I realize I just have a few on this slide, and I'll just go through each briefly, but you're welcome to scan this QR code to review at a later time. I've included the organizations I've listed on this page, and I've also put some different resources on there on the page 2. So feel free to scan that for resources at your fingertips. So Wonders and Worries is an organization based out of Texas, and they have many resources on their website. They have an app, topic-specific handouts, and they have resources for parents and professionals. And I think one unique offering that they have is a helpline where you can access a child life specialist during the week to talk to. And this can be for clinicians or for parents and families. The Pickles Group, they provide a family support kit that's available upon request, and they have parent webinars and other resources. But what I think is really amazing is that they have a virtual support group for children throughout the year from ages 6 to 18. And they've received specialized training to do this well. And so I think it's a great offering. And then Bright Spot Network, they're based out of the Bay Area. They have resources, groups, and parent webinars, and they have free books. And this organization is great, especially to support younger kids, ages 0 to 5. UC Davis, of course, we have resources. I've developed things that are accessible on our website, and I have locally available support groups. And I just started last week a teen advisory council, which I'm very excited about. And then we have Camp Kesem, which is free camp programming for children impacted by a parent's cancer. And Bev is going to talk about this resource in just a little bit, but it's an amazing resource. And they also have Club Kesem, which is something they are piloting right now. And it offers a chance for kids to be connected on a monthly basis. And then lastly, on this slide, Parenting at a Challenging Time. This is a program run through Mass General Hospital. They have an amazing website with a lot of resources. And something that I utilize regularly is a toolkit for educators. And it really helps educators have a resource to understand how to best support children in the school, which is so important as that's where kids are a lot of their time. So those are the resources. Now we've gone from diagnosis to communication, support, coping, and now what? What are the implications? So the best way we can get families resources they need is to begin the conversation early at diagnosis. I've offered some simple verbiage for opening up the dialogue, and this conversation can help families connect the dots and really epitomizes family-centered care. And many cancer centers and adult hospitals do not have a child life specialist on their team. UC Davis does in great part because of support and advocacy from my manager, Diana Sunberg, and Cancer Center site manager, Angie Escher. I would also like to thank my UC Davis colleagues who are vital partners in doing this type of wonderful work, and Bev Garber for a desire to help other families in these situations through shedding light on the child life profession, but also helping to shine light on all of the great resources we have for this population. So thank you.
Thank you so much, Emily. That is a wealth of knowledge. And as Emily mentioned in the chat, our other Emily, these slides will be available so you can reference them in the future, because there's a lot of good information that you might want to share with your families and your own children, or even your care facilities to seek opportunities that could be available to you locally. Emily, I'm going to move ahead now, and we have a question in the chat that maybe if you have a moment to respond to, or we can address at the end, because I think it's really excellent. But I'd love to introduce our next panelist. This is Jessica Dagley. She is a proud mom of 3 children and a loving wife. She was diagnosed in the summer of 2019 with salivary duct carcinoma, and she was only age 39 at the time. Jessica navigated months of treatments, the COVID pandemic, and raising her kids, who at that time were 11, 8, and 5. She works as a case manager at the University of Indiana, and she and her family reside in Greenwood, Indiana. So thank you, Jessica, for being here. If you would, please share with us the support you found for your kids and family during your treatment, and what did you find that was most helpful to you all?
Hi, thanks so much for having me. As she said, I'm Jessica Dagley, and I just wanted to share some of the things that my family did to cope with my illness and ways that we helped our children cope. As soon as I received the official diagnosis, we did separate our children. The 2 older kids, we had a talk with them separately from our youngest, and we kept it pretty simple. But then I also did reach out to the schools and let them know what was going on, so that they would have the extra support through social worker and school counselor in case there were any negative impacts there. I also like to check in with their teachers every couple weeks to see, just make sure they were doing okay at school and nothing was coming up there. But probably my number one piece of advice is to accept help. If you have help, for us was essential. I don't think we could have done it without the help that we received from our community. We had friends that set up a meal train for us, and that was a godsend to not have to worry about what was for dinner every night. And when I was exhausted from, treatments and surgery, and not have to worry about doing that. We also had friends that would drive our children to their activities and home during the week. And then I would try to attend the games on the weekends and sort of save my strength up for that, to be there for the most important things. My kids understood, I think, though, that I was extremely tired all the time, and that and luckily my husband is very engaged with our children and supportive, and he would entertain them when I was not feeling it. We really tried to keep a sense of normalcy through all the treatments. I tried my best to be home when they were home and to do as much mom stuff as I could through the fatigue and pain. We also involved our kids in the celebration of when my radiation treatments were done, and they were able to come to the hospital and watch me ring the bell. And then COVID hit after that, and then no more visitors with me to the hospital. And while I know that not everyone can do this, my mom, in our case, moved in with us for 6 months and helped out with the kids and also around the house. And that was extremely helpful. And I know not everyone would want to maybe do that, but for our family, it worked. And I also wanted to share a resource called Cleaning for a Reason. And it is a program where you can have people come into your home and do a cleaning 2 times during your treatment. And I definitely took advantage of that. And that was nice, just a nice thing to not have to worry about. But most of all, just overall, do not be afraid to accept help, and during this stressful time and stressful time for your kids. It's just really important. Thanks.
Thank you so much, Jessica. A couple things that I heard you say that I just know were also very valuable to many other patients that I've worked with and then have experienced myself, is including the school and the teacher, and if the school has resources like counseling, making sure they're aware of what the child might be, displaying in terms of emotions that might not be as clear or well spoken at that time. They might not even realize it themselves. And I think having the teachers and the staff that are with the kids look out for them and just make sure that they're catching any behavior changes, or even just checking in and asking how they're doing that day or how their mom or their dad is doing. I found that also to be very, very helpful. Thank you for sharing all of that.
Thank you.
And if you would, Jessica, what was the name of that organization?
It's called Cleaning for a Reason.
Leading for a Reason?
Cleaning for a Reason.
Cleaning, yes. Okay, I thought that made sense. So, okay, maybe we can try and find a link for that and put it in the chat so others can see that as well. That sounds fantastic.
Yeah, it was great.
Yeah. Okay, well, I would love to introduce our last panelist. This is Mr. Willie Pelote. He is a husband and proud father of adult twins. He is a survivor of HPV-attributed tonsil cancer, and works as a political strategic advisor. And he and his wife reside here in Sacramento, California. I've had the pleasure of working with Willie over the years in his surveillance, and I found his story remarkable. Because Willie, when you were diagnosed, your twins were essentially young adults. And so my question for you is, did you recognize their needs at that time? And if not, what have you learned about their experience with your treatment since then?
Thank you, Beverly. And I want to also say that I concur with each of the panelists, both Michael and Jessica. With my guys, I think they're around 16 or 17. I don't try to keep track of that. They're 25 now. And we still have these ongoing discussions about if I'm doing okay with the treatments that I've had, and where am I at this point in my life in terms of knowing that cancer is behind me now, hopefully never to return. But when my wife and I found out that we had cancer, we had just finished the diagnosis at UC, and Dr. Falwell, which I will love forever, walked me through and took the time to walk me through exactly the type of cancer I had, made it clear to me that it didn't happen overnight, that I could schedule the appropriate treatments in advance, because I think it was December the 20th, 5 days before Christmas. And I selected to let's move forward right away. And then my wife and I went over and met with the radiologist, Dr. Rao, and he spent the time with us to walk us through the treatments. And then we went back to the house because our kids were arriving from school, and we sat down with the family, with Claire and Chad, and we went through exactly what Dad had found out and what most likely I was going to experience over a certain period of time. And then we asked the kids, because at that age, you can go direct to the question of, how do you feel about it? What are you thinking? How do you feel? And my kids gave me basically 4 areas. They said, Dad, we were devastated, terrified, sad and worried, and concerned. And I said, okay, let's get into, how do you feel when you say you're devastated? They said, first, we made a list. Claire and Chad got together and they made a list about their feelings. And they said, well, wait a minute, how can Dad end up with cancer when he's doing his daily exercise, eat unprocessed food, and everything in my house is organic, and it's organic food. Dad takes supplements that are good for his health. Dad sees his doctor for his annual checkup, get his required shots. And since he's doing all these things correct, they said, Dad, we wondered, how could you have cancer? How could you have? And we explained to them, and we walked through and took our time, my wife and I, and explained to them that even if you're doing these things does not mean that you can't somehow contract cancer. And we had talked about the different types of cancer that we knew of. And then we got into, what does it mean when you tell us that you're terrified? And they said, first, Dad, we thought that you were going to die. And, they said, we thought, if you didn't die, how long will you live before you die? And then the third thing they thought about was what kind of quality of life their dad would have before I would die. And we talked about those things, saying, that doesn't mean from the cancer that I have, based on what my doctors are telling me, that I'm going to die. And what you need to do is let's continue to come together and stay close as a family that we are. And I do what I'm asked to do and required to do by my doctors. And I think you're going to have me around for a long time. And they said, well, Dad, what are the things that they're requiring you to do? And we talked about the treatment. I had to see my oncologist, Dr. Falwell. And I think I went in there once a week until everything transitioned over. Because of my lymph nodes, they found some growth in there that was different. They felt they got all the cancer out, but the recommendation was that I take 30 treatments of radiation. And I sat down and we talked about UC Davis provided me with a nutritionist. UC Davis provided me with a social worker. And it helped the kids feel a lot better that I was going to have a place where I could talk about my wellness, anything that was happening in my family. If we were all on the same page, working in this and headed in the same direction. And it made my kids feel a lot better. They said, oh, you're going to have all of this, so we don't have to worry about you when we're at school. And then I said, well, you told us that you felt sad and worried. What does that mean? And when you say that, and they said, well, Dad, think about it. Here's a father who's always engaged in our activities, always driving us to school, having a lot of energy, sitting down, having movies together, playing games together, and happy, fun, and jolly dad. And they said they thought that all of a sudden they were going to lose me in all of those activities. They felt that I would not be engaged. They thought that, and we talked about, yes, there will be a time when my energy level won't be at the same height, but that doesn't mean that you're going to lose out on us laying up here on the couch and checking out a movie or going to one of Claire's ballet trainings. I said, I may not be as focused as I should be when I'm there, but I will be there. So we talked about that. And Claire said, well, are you going to still go shopping with me? And I said, of course, we're going to do that. Yes, we're going to ride our bikes. We're going to go out to dinner. And we're going to do all of the things, including get that strong hug during the day as we pass each other, going from one room to the next in the house. And it gave them some relief. I could tell that they were beginning to feel better. And then we talked about what they wanted to talk about. Well, how can we be engaged with you, Dad, to make sure that every day you get our participation in helping you have a better day. And we went through, and about that time, believe it or not, I lost the ability to swallow. And so my son, who loved going to the gym, said, Dad, there's to make sure that I would get my carbohydrates, make sure I get my protein. And he came up with this powder that they use for those who works out in the gym. And then my daughter came up with the type of, it was not milk, it was, what do you call it, almond milk. And every day they would help me make my portion that I needed to consume every day. And that gave them a sense of being a part of the solution for their dad. And at the same time, it gave them a sense that they were a part of also working with the doctors, even though they didn't meet the doctors, to make sure that they were helping me get better. And they said, Dad, that helped with the concern that we have. And I could see in them, once they understood the treatments and once they became a part of the routine every day, I could see them relaxing. I could see them becoming themselves again. And I could see that bright light coming back in their eyes. But this is something that we can win, we can beat, and we come out on the other side, even being a better family. And what I see right now with my kids, I see them as my champions. I see them as wanting to make sure they check in, by the way. They have it on their calendar, on their phones. Did you see, I always call Beverly doctor, even though she's not a doctor. After Dr. Falwell left UC, I adopted her as my oncologist. And then they wanted to know when exact time that I would see Dr. Rao. And after that, they would say, and how's everything going? And they said, do you still have the nutritionists and the social worker? I said, well, we don't need that now because I have you guys. And I said, when you're not around, I have Mom. This has been something with your kids is critical, that you engage them, like what Michael and Jessica outlined for us in their presentation, and let them become a full partner in the solution part of this. And it is amazing how it gives you a lot of the treatment that you need that helps your body, and you come out the way that we're coming out so far. And so far, I think the way I would like to end is that it's been 7 years, February the 2nd. And Michael, it brought back on old memories when I saw that radiation thing that they put on us. I threw that thing in the back house and I haven't gone out to see it since. And Jessica, when I rang the bell, I've never been back in that room since as well. But it was absolutely difficult for my kids when they saw after 5 weeks of radiation, the changes on my neck. And it was serious for me. And I went in that day for my treatment. And I said to the radiologist, the young people that works in that room, I said, I'm done. And they said, Mr. Pelosi, you want to have 2 more treatments? I said, okay, let's get this over with. So that's the end for me. It was phenomenal. Thank you so much for having me today.
Thank you so much, Willie. That's a great recount. And I think what's remarkable about kids, especially as they get to be older, they actually are parenting you in a way, which I think probably was empowering for them to have a hand in your care. And I think an important difference between young children and school-age children and basically young adults. So thank you, everyone, for your participation. I think the next few slides, we want to make sure there's plenty of time for questions. As Emily mentioned earlier, KESM is a wonderful resource that the Alliance has partnered with in just getting word out to everyone. I was unaware of this organization when my daughter was having support until Emily mentioned it, and she went to Camp KESM last summer and loved it and can't wait to go back next summer. And what CSM is an organization that's geared towards children who are impacted by a parent's cancer. And this is actually the Awareness Month. And actually, I think starting tomorrow is the open for applications for new participants. So if you aren't familiar with CSM, please take a look at their website, learn more about it. It's a free camp for children who are impacted by a parent's cancer. And they have just lots of really wonderful resources and connections. So a wonderful resource to tap into. And the next slide shows a picture of me and my family. The fun thing with CSM is they don't go by the kid's name. They each get to choose their own name. So this is my daughter, or also known as Lemur, at Camp CSM last summer. And it was just a wonderful experience. So I thought I'd highlight that as well, since that was new to me. All right, our next slide here. I think we will be getting to the point of question and answers. Again, here are some resources, and all of this will be posted on the website with the Head and Neck Cancer Alliance for future reference. And certainly in the chat, if there are other questions, please, we welcome any questions you have. I see that Emily went through several of them, and I would echo many of them in terms of what we've talked about today. One of the questions was how to talk about a cancer diagnosis and treatments even after the fact, when maybe that hadn't been a discussion point at the time. And that's really, a nuanced question for me. But I would imagine, just again, assessing the child's interest and questions and curiosity that may have come up around that time. And then just exploring those in conversation could be a good start. And then another question about prognosis. And I can imagine that is a very delicate conversation. And I thank Jessica for sharing her insight and Emily's input. I know kids have strange perceptions of time based on their age. And so that could be something that's hard to put down on paper, because maybe that could be something that's held on to too strongly or relied upon, and then maybe things change, and then that's another transition that you have to navigate. So again, I think every family and situation is different, but I think that can be a really challenging conversation. And I don't know if any of the other panelists had, thoughts on that. I know with Michael and Willie, different cancer types than what Jessica experienced, and they all have very different prognoses. But from your standpoint, would you have any thing to say about, how to discuss the overall prognosis? I know Willie kind of touched on a bit of it, but how about with you, Michael?
Oh, I mean, I think I see this from sort of two angles, because as someone in the medical field too, I know that, estimates of prognosis are often just that. And so that you could be telling, a child something that really, might not be that accurate, either in a good way or a bad way. And so it's very complicated. Uh, I do think that for me, again, I would try to be transparent, say, there's a lot of unknowns in the language that's appropriate for the kid, and just, prepare, I guess, for the possibility that things could be in a way that we're not excited about, not happy about.
Right, thank you. And I have some other questions that I can address. If anyone else in the chat wants to continue to post their questions, please do. We're an open book around here, so we're happy to address anything that might come to mind. Some of the questions that I've been asked over the years by parents, have stemmed from things that we've all touched upon. How do I communicate the treatment? How do I communicate how I'm going to feel? And like Willie said, radiation with or without chemo, and even surgery really can cause a lot of fatigue, and that can really change the amount of energy we have with our children. And I really appreciated his insights in trying to remind the child or even young adult, that there are still ways to connect that may not be as energetic as they used to be. And then reminding everyone that routine for children is so helpful in trying to maintain you know, if they are in a soccer practice, continue to try and use our resources in the community and family to take them there if you're not feeling well that day, and just continue those other energetic outlets that you might not be able to do. You know, another question that I thought was very interesting that I'll put to everyone, you know, children are very honest, and sometimes they ask questions just purely out of curiosity. You know, they don't know that what they're asking might be insulting to you or feel hurtful. And there can naturally be a defense mechanism that comes out because of how you might feel as a patient who's had a change in either their appearance or their speech or their energy level. So what insights, Emily, might you share to how to communicate with children? I'm assuming mainly young children are more apt to do this than older, but you know, maybe across the age ranges.
Yeah, that is a good question about how to approach that. And I think, yeah, it depends on the age of child. But if we go back to some of the simple tips when communicating with children, keep the information very simple. I think respond with warmth and appreciate their curiosity, because kids are curious. It's not that they're trying to offend you. They're just trying to better understand something that doesn't look familiar to them. But answering their question can help them if they see somebody else going through something similar. So just kind of sharing that I had an illness and I had to get surgery for my illness, let's say. The doctors are taking really good care of me, and I'm really glad you asked me that question so that you can better understand my situation, and just kind of approaching it in that way can be helpful.
Great, thank you. Anyone else from the panel have something to share about that, either a personal experience if they had one, or just an insight that they found helpful for them? I'll just anecdotally say, you know, when I lost my hair through chemotherapy, which I know is for a very different treatment, you know, I had lots of curious kids asking about my hair, and if I was, you know, a boy or a girl or something. And it was a little shocking at first, but it was also, as Emily said, you know, coming at with, you know, sincerity and warmth to the child. And then they were very happy to keep checking in on me when they would see me again. So I think just not creating a sense of something to be fearful about or startled, you know, them is still hard to do, but definitely valuable. So another question that came up with a lot of my patients as well, and I know this might be very different for our panelists, because again, every cancer is so different in what patients need and how they feel or how they look. And some of the issues that have come up would be if a patient has a surgery or a treatment that requires some sort of piece of equipment, for example, you know, a tube outside of your nose, the tube in your belly, a tube in your airway, stitches and staples. I mean, at some point, anyone who's had surgery has some experience with those, a chemotherapy port. So again, how do we best communicate to our families or children in a way that doesn't create fear about those? I know Michael did a great job with including them, and Willie also shared, you know, including them in the process. Any other insights from the panel about either their personal experience with that, or thoughts about how to navigate, you know, how to discuss medical complexity, you know, of these tubes and things that, you know, don't look like yourself? Maybe Emily. Oh, go ahead, Jessica. Thank you.
If you like, yeah, I had a neck dissection, and so I think that really just the scar or the staples and the stitches scared my children. So I mean, I just had to explain to them and be honest about, and I had 2 drains, as you saw in the picture, but just explain to them honestly what happened and what they had to do. And I think that just the honesty helped them understand. And then I ended up with a feeding tube as well, and just letting them, like Michael did, participate in helping me to have nutrition. And they saw me losing weight. They saw me choking on food. They knew that I couldn't eat due to mouth sores. So, I mean, I think that they understood that I needed it, and they weren't really that scared. I mean, I think they, even when friends would come over, they would tell them about it. So it just kind of became normal.
Great. Thank you, Jessica. Emily, I know you work in the hospital as well. And of course, that's a very vulnerable time. Any insights on how the family and children, I mean, of course, COVID added its own barrier. But if parents choose to have their family or children see them in the hospital in a state where there's a lot of medical equipment, any guidance on that?
Yeah, so inpatient, preparing kids for what they're going to see related to their senses can be helpful. So what are they going to smell, see, hear while they're at the hospital? Showing pictures beforehand is great. And then helping to support that visit throughout so they feel as prepared as possible. And there are a lot of different details to think about for those visits. Getting a child life specialist involved is really helpful so they can prepare kids beforehand, support the visit, and then debrief the visit afterwards. But parents as well can do this, take pictures and talk through what they're going to see in the room. Outpatient, I would mention something really accessible for parents who have younger children are medical play kits. And I've sent so many stuffed animals home that are patients with ports. And really that's just something that I make as a port, but really so that they can manipulate that. Because of course, when parents come home with these different medical interventions that have happened, children can be scared, and there can be different rules in the house because of how the parent is coming home, like they can't roughhouse with dad anymore, or they can't cuddle with mommy on the chest. And so helping children process and play through some of this information can help them be in the driver's seat, which allows them a sense of control in a very out of control situation. So even just some of those simple things can be really helpful.
Great, thank you. I know we're getting close to the end of our webinar. We've got a question from someone in the Q&A. For school-age children who might be struggling with homework, what advice or suggestions might you have? Maybe, the parents who had, the kids going through kind of, whether it's middle school, where the homework could be pretty heavy, what kind of ways did you navigate that? Willie, I suppose your kids were older for that and probably already getting to their high school, college prep. Maybe their homework skills were probably a bit more honed in, but for me, my daughter, again, different scenario for me, but as far as being an 8-year-old in elementary school, there was some homework that needed to be done. And I actually used that as an opportunity to connect with her. We would do that together in the periods of time that I was available. So again, while that may not be fun, it could be one-on-one time with that parent, and kind of give the child or the school-age child an opportunity to have that special time just together that can also meet the needs of getting the homework done. Any other advice?
I would say, oh, go ahead.
No, go ahead, Jessica.
I was just going to say to just, like I said earlier, reach out to the child's teacher because they maybe can offer some assistance and maybe just help. I mean, if they're having trouble focusing, maybe they can decrease the workload. That's all.
And my wife took the lead on all of that. And then the kids would come in and check in with me, crawl up in the bed, and we would go over everything. But my wife was basically the lead.
Yeah, I think I agree with what Willie was saying too. I think that one of the things about going through this process is that you cannot do everything, and there are certain things you have to prioritize. And so it might be a situation where some of the homework checking or homework help you were doing, it has to, go away for a little bit because there's other stuff that you have to do, and that's okay. You're still going to be there for your kid, even if you can't be there for them the exact same way all of the time. And I think it's okay to kind of let yourself do that. I think it's really important, actually.
Great. Thank you all. We are out of time. We had some amazing conversation and information. So thank you all for being here and sharing, you know, a pretty vulnerable situation in our lives. Parenting's hard enough, and then to do that with a cancer diagnosis and treatment is pretty impactful. So again, I'd like to thank everyone, Emily, Jessica, Michael, and Willie, for being on our panel and providing your insight, helpful tips and experiences, which will have great impact on helping other parents that are going through a head and neck cancer diagnosis and its treatments. And of course, a special thanks to the Head and Neck Cancer Alliance and the American Head and Neck Society for time in organizing and hosting this webinar, Parenting Through a Head and Neck Cancer Diagnosis, Treatment, and into Survivorship. All of these slides will be available for future reference, and a future recording also available through the Alliance. So thank you all for your time.